Do you ever get a pain right here, kind of right below your belt line, on the bump or around the bump on the back of your pelvis? It could be a sharp pain when you get up from seated for a while. It might be painful when you lie on that side or when you go up and down the stairs. It could also refer into the glute, the side of the leg, the groin, or even the front of the leg. If this describes your pain, you might be dealing with a sacroiliac joint problem, also known as the SI joint. In this video, I'm going to show you how you can minimize that pain in the comfort of your home. Stay tuned. Thanks again for tuning in. My name is Dr. John Saunders. I've been in clinical practice for 18 years, seeing patients dealing and managing spinal-related health issues. I'm going to show you what I believe the most effective at-home treatment for a sacroiliac joint problem. Quick anatomy lesson here. Your sacroiliac joint or your SI joint is a large joint. It basically attaches your innominate or your pelvic bone to your sacrum, which attaches to your lumbar spine. The primary role of this joint is to load transfer between your upper body and your lower limb system. So we need this joint to be stable. Sometimes this joint becomes unhappy. It becomes inflamed, it becomes hypermobile or hypomobile, both problematic. Understanding most people overstretch this and make the joint worse. This joint is meant to add stability between your upper and lower half. If you overstretch a joint thinking it needs to move more, you're likely irritating the joint. Knowing this joint should be stable without a ton of motion in there will direct how we can fix this in the comfort of your home. There are a few reasons why your sacroiliac joint might not be happy. The first exercise we're going to do to help you fix your SI joint problem is to mobilize. Remember, this joint doesn't like to be moved a lot. It should be stable, so don't pull this to its full range of motion. We're going to do all of these mobilizations and stretches and exercise on both sides to keep everything in balance. I really want you to concentrate and focus and visualize what you're doing with the stretch. So for the first one, all we're going to do is we're going to keep both knees bent. We're going to bring one side up, and we're not going to pull it up and create flexion in our lower back. That could cause an injury in our lower back. We're just going to pull up and visualize some mobilization going through our SI joint. If this is easy, then what we can do is we can drop our other leg and to create a little bit more mobilization through that joint. And for some of you, your opposite leg may not come down all the way, and that's a problem we're going to address momentarily in this video. If this is too easy, then you can get on a bench like this, come to the edge, and we're going to start here. We're going to bring this up, mobilize the SI joint. We're going to hold this for 20 to 30 seconds. If this becomes easy, even with the leg, then we can take our leg and pull it off the side, just to create a little bit more mobilization in the SI joint. Now remember, we want to do this on both sides 2 to 3 times, holding the position for 20 to 30 seconds. So we have placement 1, 2, or 3. Never, ever pull both legs up like this. It creates flexion in your lumbar spine. If you have a disc problem, it is going to irritate it. We want to strengthen around the joint to create more stability in the SI joint. One of the first ones we're going to do are simply clams. So we're going to be neutral head, neutral posture, and we're going to just come up laterally. And we're going to do 12 to 15 reps a side. If being on all fours is challenging due to a balance problem, a very simple alternative will be to take a pillow, get on our side, and very simply rotate up. This is a controlled movement. These are endurance type exercises. We don't have to use a lot of force. We want to really think, contract all the gluteal muscles that support the SI joint. And again, we want to perform 12 to 15 reps, 2 to 3 sets on each side. From here, we can move right into the adductor exercise, and this is a simple one as well. You can pull one leg up like this, try to minimize the torque in your lower back, and we're just going to take the downside leg and we're going to raise up. Hold for 2 to 3 seconds, and you can rest your head down just to keep stress out of your spine. We're going to do this 12 to 15 reps, 2 to 3 sets on each leg. Think about the movement. Again, you're trying to isolate and really contract the muscles. These are not exercises you rush through. These are concentrated, controlled movements. And you will feel fatigue in the glute when you're doing the clams and the adductor muscles when you're doing the adduction raise. For the next exercise, we're going to use our glutes. This is a very important muscle to activate. Oftentimes our glutes aren't activating properly. So this is a great exercise to activate our glutes to support our pelvic ring and our SI joints. So there's a few variations for this one as well. The first one, we're going to just lie flat and we're going to come up. We're going to really isolate and contract our glutes, focus on them, contract for 3 to 5 seconds, and then come back down. And up and down. You'll perform this 10 to 15 reps, 2 to 3 sets a day. If this becomes easy, the next variation will be just to take a pillow. I like to fold it, and I want you to squeeze while you extend into the glute. So now you're going to fire your adductors as well as your gluteal muscles. Really good stabilizer exercise. This is actually really good for the low back. What you want to make sure though is you don't hyperextend, because then you're going to irritate some of the posterior joints in the lower back. And if you really want to add another dimension, get a TheraBand. We're going to place it below our knees. Get it nice and flat so it doesn't hurt your knees. Externally rotate, and again, come up. Don't hyperextend. Fire the glutes. A 3 to 5 second contraction at the top, stabilizing the SI joint and working your glute muscles. Stretching. We overstretch. We overstretch joints that are supposed to be stable, such as our low back and our SI joints. We do need to stretch to help our SI joint, but not the SI joint itself. We need to stretch our psoas muscles. We sit way too long. Our psoas are chronically contracted, contributing to both SI joint compression and low back pain. This tip alone, if you stop overstretching your SI joint, you are going to get benefit from this video. So how can you stretch your psoas muscle? Well, this is a muscle that can be stretched a variety of ways. I'm going to give you 2 variations, and you choose the one that creates the best stretch and the least amount of pain in your SI joint. One of my favorites, you lie on your side, just a neutral, relaxed posture. Take your one leg and you're going to grab the ankle and just very slowly, again, you're not going to hyperextend, but you want to shove your pelvis on the same side a bit forward. You should feel that through the front. You might feel that a little bit in the back, and you also might feel it in the front of the thigh. This is normal. A stretch should be held for at least 30 seconds, 2 to 3 times on both sides. Again, we're just going to relax posture, rest your head down. We're going to pull back. As we pull back, we're going to push our pelvis forward and getting that great psoas stretch. One of the more popular ways to stretch the psoas is in a split squat. And basically, I know you probably can't see my head here, but that's okay. You're going to take your hip, you're going to drive it forward as we're contracting our glute and extending just slightly back. Again, you don't want to overextend here. You're going to irritate your lower back, but visualize the muscle elongating in the front of your hip. This is how you know you're stretching your psoas. 2 to 3 sets, each side, hold 20 to 30 seconds. I know if you perform this routine, you'll find the stretches, the mobilizations, and the exercises that's going to help your SI joint heal. I suggest you stick to the ones that are most comfortable and least irritating. For some of you, that might mean changing the side you've been stretching or working. Oftentimes, you're working the wrong side. You're working the hypermobile SI joint. We want you to work the hypomobile to try to restore proper function and alignment and core strength within the pelvic ring. If you're doing this and you're finding it's just not helping, oftentimes you need to get your pelvis, your SI joints, or your sacrum realigned. If you like this video, I'd appreciate it if you give me the thumbs up and show some support. And if you haven't yet, I'd really appreciate it if you hit the subscribe button down here and the notification bell so you can be informed when I upload a new video. And as always, if you have a question, a comment, leave it below. I will answer that. It's really encouraging hearing from you viewers, and it motivates me to continue to produce good content for you. I hope you enjoyed this video. Until next time, be well.